Health experts say artificial intelligence could be at the core of the health service in the next 10 to 20 years. Already, researchers in the North East are leading the way in developing AI to improve patient care and bring down waiting times. Among the developments is a new app for those who've had melanoma to detect a recurrence of the skin cancer. Reem Sattar has the details.
Adele will always remember Christmas Eve of 2019. It was the day she was diagnosed with stage 3 melanoma. She went on to endure 18 months of treatment for skin cancer.
We were totally blindsided as a family because I think, there's a massive misconception that skin cancer can just be cut away and cut out. So for me to be told that it had gone into my lymph nodes, I was absolutely devastated.
Like all of those who've been diagnosed with melanoma, Adele keeps a close eye for changes on her skin. But now, a new app developed in the North East has been designed to make that easier. It uses artificial intelligence to help gain a clearer picture of any changes that could need further investigation. It's one of several new AI advances that medical experts predict in the next decade could drastically change our healthcare and help cut waiting times.
With pressures in primary and secondary care, delivering that care can be challenging. So this ASAGA is a strategy that would reduce the burden on them in terms of having to travel to clinic appointments, and also there are benefits for the NHS as well.
There's been quite a lot of kind of leading work that's come out of the northeast of Scotland. Certainly the work that we've done around triage, there's been a lot of the work done around kind of, breast cancer. The next kind of 10, 20 years, that I think we will be, working and living, with a health service that, has AI at its core in terms of, how services are delivered.
For Adele, her regular checkups will become annual once she reaches 5 years after treatment. She believes the use of AI, such as the app, could benefit those with melanoma and other patients.
I'm really anxious. These scans have always been my security blanket. I think having these tools that we can go to and not having to rely on the NHS and wait months, even sometimes up to a year for appointments, definitely reassure patients and give them more ownership over their own body.
Artificial intelligence is already being used by the NHS, and its use will only continue to grow. The question is how some patients may adjust to its increased use in our healthcare system. But the ultimate aim is to save lives and to improve the lives of people like Adele. Reem Sattar, STV News.